Sweet on the tongue, silent in the body. Diabetes is a hidden challenge we all need to know about. It's not exactly the sugar you eat, but the sugar you don't manage. And that is why you need to control it before it controls you. Welcome to Health Matters, your number one guide to health and wellness. I am Amanda Amos-Igbuwe. Diabetes has become a huge concern in Nigeria, with a recent data from 2024 revealing that approximately 8 million adults suffer from this health challenge, which is around 7% across the country. Type 2 diabetes, however, accounts for over 90% of these cases. Another statistics from the International Diabetes Federation estimates 2,988,500 cases of diabetes. Joining us to unpack this sugary matter and helping us understand and defeat diabetes is Dr. Peace Eronmosele. Thank you for joining us, Dr. Peace.
Thank you for inviting me. I'm really happy to be here.
Okay, so let's start our journey to victory, if I may say.
Yeah.
So, starting from the basis, what really is diabetes?
Okay, so simply put, diabetes is a condition where there's a problem with insulin that causes high blood sugar. So it's either your body is not producing enough insulin, or there's a lot of insulin, but the body is not processing it the way it should. And insulin is very important because it helps your body to process sugar and to use sugar appropriately. So if your body can't use sugar properly because there's resistance or because there isn't enough insulin, it causes high blood sugar, which is what we refer to as diabetes.
Okay, so from research, I saw there's type 1, type 2, and gestational. Apart from that, though, there are like other different types of diabetes.
Yes.
But then type 1, type 2, and gestational. And what are they, and why are they grouped into types? And then instead of type 3, we're having gestational.
Okay. So type 1 diabetes is the type where, like I said previously, diabetes could either be because you're not producing enough insulin. So that's type 1. So the body is not producing enough insulin, usually because the pancreas, which produces insulin, that's an organ in your body, is being attacked by your own body cells. So we call it an autoimmune condition. So because of that, your body can't produce insulin, and that leads to increased blood sugar. Then for type 2, which is more common, like you mentioned before, that's the type where the body has insulin, but the body's cells are resistant to it. They're not allowing the insulin to do its work. Then for gestational diabetes, some people actually jokingly call it type 3, but it occurs in pregnant women because pregnancy can cause a lot of things, but among those things, in some women, it causes insulin resistance. So it's kind of similar to type 2 diabetes because there's insulin, but the body is not using it properly. So that's gestational diabetes.
Okay. So apart from like these three types of diabetes, what are the other types? Are there other types? What are they?
Oh, there are a number of types. We have what we call latent autoimmune diabetes in adults. So usually type 1 diabetes, the one where the body is attacking the organ that produces insulin.
Pancreas.
Yes, the pancreas. That one usually occurs in children, but there are cases where it can occur in adults. So that's a separate type. And then there's also what we call maturity onset diabetes of the young, meaning that the type 2 diabetes, which usually occurs in older people, it occurs in younger ages. And we're seeing more of that now because a lot of people are overweight. We're seeing a lot of teenage obesity, and that is leading to type 2 diabetes, which used to be known to be seen in adults, but now we're seeing them in even teenagers. Then there are some other types, but they are not very common, like steroid-induced diabetes.
Okay, so what leads to, one thing I've noticed, if you, minus research, like if you observe people, one thing I've noticed is that hereditary plays a very important role. So I'm guessing that apart from, there are other causes, but then hereditary is important. Yes. So what other causes are there, and how does hereditary really factor in diabetes cases?
Okay, so I'm going to mention heredity first, because it's a very important factor. If you have one or both parents with type 2 diabetes, for example, you have at least twice the chance of developing diabetes as the average person. Some studies say 2 to 6 times. You're 2 to 6 times as likely to develop diabetes. So your family history is a very strong indicator of whether you're likely to get diabetes or not. But apart from that, there are other things. Being overweight or obese is a very strong risk factor. A sedentary lifestyle, meaning you're not exercising, you're always staying in one place. Then apart from that, there's also certain drugs, but that one is not very common. There are certain lifestyles that can lead to it. But the main things are genetics, that's hereditary causes. Then there's also diet and exercise, that's lack of exercise.
Sorry, let me ask you a very silly question. If you jump buses every day, does that, because I feel like we are undermining that, so does that like kind of
Unfortunately not.
Okay.
I mean, you could count the running around to get to the bus, because I mean, if you're walking really fast and you're trying to run, it does count as exercise. It does count as exercise.
So what age group are prone to diabetes?
What age group?
Yes.
Well, it depends on the type. So like I said, for type 1, the autoimmune type, it's usually seen in children. Then for type 2, it used to be an adult thing, but these days you can see it in teenagers, you can see it in adults. So there isn't really a specific age for diabetes.
Okay, so when I was younger, there's something I used to hear that if you have diabetes, when you urinate, your ants will start gathering your urine. I haven't thought to check if like ants are gathering my urine, but first of all, debunk this thing for us. Let me know so I will go back and tell the people who gave me the information that okay, you're wrong, you're right. And then also, what are like the common factors? What are the common things that we see that okay tells like our body is telling us okay, this is a sign of diabetes?
Okay, so the people that told you, they're actually right. They're actually right.
Okay.
Yes, because like I said, diabetes is high blood sugar because your body is not processing sugar properly. So when there's too much sugar, your body is trying to get rid of it as much as it can. And one of the ways that it tries to get rid of it is through the urine, through the kidneys. And so that's why you see an increased blood sugar or increased blood glucose, increased glucose in the urine.
Okay.
Yes, and that is why ants might gather. Yes,
okay, so
yes.
that's
So
true.
it's actually true.
I'm shocked.
It's actually true.
Okay, so what are the other signs that your body gives?
Okay, so common signs, increased fatigue, like you're tired all the time, and that's not your normal. There's also increased thirst, like you're extremely thirsty all the time, drinking a lot of water, but it's not doing anything. There's also increased hunger, like excessively increased, like you're normal, and then it's like you're always hungry. No matter what you eat, you're never satisfied. Then there's frequent urination as well, because like I said, the body is trying to do its best to get rid of that excess sugar. Okay. So it's trying to, you're urinating more frequently. Those are common symptoms, but there are so many symptoms because diabetes has a lot of complications, and with each complication there are like a lot of symptoms that can occur.
So now there are different tests, I presume, or first of all, are there different tests to check for diabetes? What are the different tests, and is there like a universal test for diabetes to check for diabetes?
Okay. Well, if you want to say universal test, it is checking your blood glucose.
Okay.
So all the variations of diabetes tests are checking your blood glucose, that's your blood sugar, in one way or the other. So we have what is called the fasting blood sugar. So you take it in the morning when you haven't eaten overnight, and that's what we call the fasting. We have values for that. Usually if you have more than 126 milligram per DL, that indicates diabetes. We also have random blood sugar, which you can take at any time when you've already eaten. Then there's also what we call the OGTT, oral glucose tolerance test. Basically, we're testing in real time how your body processes sugar. So we give you a sugary drink and see how your body processes it. Then, and there's also the HbA1c. That one checks your sugar control over a period of 2 to 3 months. And so we can use it to see if you've been, taking your drugs. For someone with diabetes, if they've been taking their drugs and adhering to lifestyle changes.
Okay, so this is kind of like a two-in-one question. If someone has diabetes, apart from, I think personally, my own opinion, like apart from saying throw out your junk food, apart from that, what other advice would you give to a person? And then what are the complications of diabetes?
Okay, so let me start with the advice. I think the number one advice I would give is take it seriously, because so many people do not take it seriously. Because when diabetes starts, all you see is your blood sugar is high, but sometimes the symptoms are manageable or they are barely even there. So you might feel like, okay, I'm fine. But meanwhile, that high sugar in your blood, because it's not supposed to be there, it's causing damage to your blood vessels, to your heart, to your kidneys, to basically every part of your body. So the number one advice I would give is take it seriously. Go see a doctor, go and get medication, listen to the lifestyle advice. So for
the complications.
Yes, for the complications. The complications are many. So diabetes can affect virtually every organ in the body. It can affect the blood vessels, leading to what is known as peripheral artery disease, meaning that there are issues with your blood vessels, like your arteries and your veins, your arteries, that is not allowing blood to flow properly, and that can cause damage to different parts of your body, especially the feet. And there's it can cause problems with the heart. Some people, they don't even see signs till they have a heart attack, and that's how you know that, okay, they've had diabetes or they're not properly managing it. Then it can also affect the kidneys. That's the common complication we see. It can lead to kidney failure. It can lead to nerve problems. So people have tingling sensations in their hands and their feet because the high blood sugar is affecting the nerves, and so they're not working properly. And it can also lead to slow healing wounds or wounds that don't heal. And that's what leads to what is known as diabetic foot. And in many cases, if it's not well controlled, can lead to amputation of limbs. Okay. So there are lots.
Yeah, so when we're seeing type 1, type 2 gestational, we saw that these diabetic conditions affect like various groups of people. So there's children, there are pregnant women. So now, for children, for pregnant women, what are the different treatment options available? And then how do they differ from the average person who has diabetes?
Okay, so let me start with children. So since in children, the commonest type of diabetes is type 1, usually the solution for that is insulin, because the body is no longer producing insulin. So you need to replace it. You can't exactly make the body start producing insulin again. Medically, that's not possible. So you have to replace that from the outside. So that's the number one. Of course, there are lifestyle modifications, but that's number one. Then for gestational, right?
Yes.
Gestational, it's basically, like I said, the cause of gestational is pregnancy hormones are causing insulin resistance, and that's similar to type 2. So we use drugs for type 2, but because of the baby, yes, there are some drugs that are not safe. So we always take that into consideration when we're prescribing drugs for pregnant women.
Okay, then the average person, what's treatment option?
The average person, like we said previously, type 2 is the most common. So for the average person, you start with drugs and lifestyle modification. Both of them are very important. So there are common drugs like metformin, glimepiride that we start people on, but even for type 2 diabetes, depending on the severity, some people might need insulin, some people might need gliptins. There are several categories of drugs, but the most important thing is that you go to your doctor and then you let them determine the best drug for you till you achieve a normal blood sugar level.
Okay, so is there, out of curiosity, is there a cure for diabetes, or do we just manage it till the end of time?
Oh my God, patients ask me this all the time.
Okay.
And sometimes I'm hesitant because technically there's no cure, but there's what we call remission.
Okay.
So a lot of times when people hear that, they're happy because they're like, I can get rid of it, but then they're not willing to do the work because it takes a lot of work. So what we call remission is that it's not like diabetes is not there, but because you're being very strict with your lifestyle, with your diet, with exercise, then you can actually achieve normal blood glucose without medication. So it is possible. It does happen, and I've seen it happen, but it's not very common because it takes a lot of work that many people are not very willing to do.
Okay, so there was one time I was on a Telegram group trying to like lose weight. So there was this dietitian, and he's like, don't take fruits like in excess because fruits contain sugar. And as a diabetic person, do you advise them not, like, debunk it? Do you advise them not to take fruits because there's sugary content in it?
So for diabetes, we like to preach balance, especially when it comes to natural foods. Of course, processed foods should be cut out, but for natural foods like fruits, we always advise a balance. Now, for people with diabetes, sweet fruits, like really sweet fruits, pineapples, oranges, those should be taken like very minimally because they can spike the blood sugar. But if you're talking about the average person, it's not a problem as long as it's done in moderation. Everything has to be done in moderation. Everything has to.
Okay, so like, this is the final question. I was reading the figures: 2,988,500
That's
cases.
a lot.
It's a lot. Is Nigeria equipped to take care of these diabetic patients?
Yeah, the funny thing about that number is that it might actually be more in real life because there's a lot of data that isn't collected or reported. And to be frank, especially now with Japa waves and all, we do not have the capacity. We do not have the capacity to handle these cases, which is why when I see patients, I try as much as possible to emphasize the parts that they can control. That's the lifestyle and the diet, so that they don't have to spend so much on medication, because medication is so expensive these days, so that they don't have to spend so much on medication, so that they don't have to go to the hospital as often and pay those expensive bills, and so they don't end up in emergencies where doctors might not even be available because we're understaffed.
Okay, I know I said final question, but it permits me. I didn't really talk about the fitness aspect, and then I know that as much as science is against herbs, there's a fitness option. And then, like, you see a lot of people where I'm from, you see a lot of people, once they feel the sense in their spirit, man, that they're diabetic, they start taking bitter leaf and all of that. So are there like herbal remedies? You said it's expensive, so for the low class people, are there like herbal remedies? And then what is the fitness aspect?
Okay, so let me just say this first of all: most, if not all, herbal remedies that are sold are scams.
Okay.
Straight up, they're scams.
Okay.
And even for those that say that it works, a lot of times, if you ask them questions, you'll see that they're using it maybe alongside their diabetes medication, and they won't tell you that. Or they're doing a lot of lifestyle and diet modifications behind the scenes, and so it seems like it's working, but it's not really. Your other question.
So you mentioned diets. What are the like diet modifications and their fitness aspect?
Okay, so diet modifications, like I said, we like to preach balance. So you need to limit or cut out completely. That's the recommendation. Processed foods. So that goes from sodas to meat pies to basically anything that is any food that is processed. You should avoid it because those easily release sugar into your bloodstream, and you don't want that, especially if you're someone living with diabetes. Then for the fitness aspect, what is recommended is 30 minutes of exercise, and that's not just walking. Like, active exercise, the one that makes you break a sweat,
Yeah.
at least 30 minutes, 5 times a week at the very least, but every day is recommended.
Okay.
Yeah.
So in summary, there might not be an option for like the low class people, really. There's no option. Like, and it's really, it's really sad. Like, sometimes these people take this processed food, I believe, because it's a cheaper option available there. But then seeing that it leads to like a decline in your health, and then there is no option for them. It's definitely sad. But thank you so much, Dr. Peace, for such an
Thank you.
amazing lecture. Thank you.
Thank you too.
Okay, so I'm glad to know that diabetes is not a death sentence, but it can be managed, and it is more important to know that diabetes does not discriminate, but we can fight back with education, lifestyle, and more importantly, diet changes. For any question on today's topic or previous ones, don't forget to send a message to healthmattersbdtv.ng@gmail.com. I'll take it again, healthmattersbdtv.ng@gmail.com. I'm Amanda Amos-Igbuwe saying stay safe, stay healthy, because you will definitely be fine, and keep watching Business Day television.